Welcome to Go To Practice Solutions, a new monthly video series from AHA. We took some of the most confusing, pressing, or challenging issues facing the profession and asked our industry partners for their solutions. We'll be bringing you case-based studies on a new topic every month. This month, we're talking about the pain point of, well, pain. The AHA Pain Management Guidelines emphasize the importance of a proactive, multimodal approach that includes both pharmacological and non-pharmacological treatments for pain. The problem is, how do you identify and select appropriate non-pharmacological treatments and incorporate them into your protocols? PulseVet is a leader in veterinary shockwave therapy used around the world. For our solution of the month, PulseVet will be sharing their approach to using this treatment modality to provide effective, non-invasive therapy for pain. Take it away, PulseVet.
Greetings and thanks for joining me. I'm Dr. Robin Downing, and I am the hospital director for the Downing Center for Animal Pain Management in Windsor, Colorado. As a pain expert, I spend a lot of time helping my colleagues deal with patients who have chronic pain issues. And what I'd like to do is share some ideas with you in this program. So first of all, we understand that overall, our pet population is aging, and it's aging pretty quickly. I'm seeing in my practice cats get into their 20s, and I'm seeing big dogs get well into their teens. What we know is that across all age groups, approximately 20% of dogs and cats are dealing with the pain of osteoarthritis. And we know that the incidence of osteoarthritis actually increases with age. So the older they are, the more likely it is that they are going to suffer from osteoarthritis. We also know that old age is not a disease. And so the idea that a pet is just destined to slow down and not be able to do the things that they want to do, that's just ludicrous, because we have some excellent tools to help keep them healthy, happy, mobile, and really preserve that precious family-pet relationship. So when we deal with chronic pain, we know that we get the best outcome when we deal with that pain from a multimodal perspective. Multimodal means using different tools to attack the same problem. We know that we have three big categories of multimodal pain management for our patients who suffer from chronic maladaptive pain. We have pharma, we have non-pharma, meaning nutraceuticals, nutritional supplements that act like drugs but aren't drugs, and physical medicine. And physical medicine actually encompasses a number of different techniques, and I'll get to those in a minute. From a pharma standpoint, we know that non-steroidal anti-inflammatory drugs still form the cornerstone of chronic maladaptive pain management in cats and dogs. But to non-steroidal anti-inflammatory drugs, we need to add other tools. We know that chronic pain is maladaptive pain, and that means a non-steroidal alone is really not going to address all of that animal's pain needs. And that's where a medication like gabapentin comes into play. Gabapentin has become really a key element of helping painful pets be more comfortable. We also know that we can provide good joint support from a pharmacological standpoint using polysulfated glycosaminoglycans. At this moment, that means using a product named Adequin. Adequin does work in both dogs and cats, even though it's only licensed and labeled for dogs. It's very well tolerated by cats. Moving into non-pharma, we actually have multiple very effective nutraceuticals to help us with the chronic pain of inflammatory disease in the joints, osteoarthritis. But here's where we veterinarians have to really take a stand. It's up to us as data-driven doctors to demand that we see data about the nutraceuticals that come into the marketplace. And that means really seeing studies that have been conducted in animals with naturally occurring osteoarthritis to help us make the best choice on behalf of our patients and really help our clients sort through all the nonsense that's out there on the internet about this supplement or that supplement that will solve all their problems. Moving on to physical medicine, this is a really important aspect of chronic maladaptive pain management. And it's one I think that we as veterinarians sometimes overlook. Some of the simple things that we should be thinking about when we think about physical medicine are things like helping our clients modify the home environment. Every one of our clients now has a camera in their pocket, and it's easy for us to simply ask them to show us, where does this cat live? Where does this dog live? What are the activities of daily living? What are the floor surfaces? Where does the dog or the cat like to spend their time? Where do they sleep at night? Do they sleep on a bed? If it's a bed, is it a tall bed that's far from the ground that might actually be difficult for them to get up onto or off of? What about stairs? Are these pets that should be restricted to have access to stairs when no one is home? We also have adaptive devices that we can use, that we can guide our clients to use. There's some really terrific vests now with handles to help our clients support their dog. So they're not trying to pick that dog up and potentially hurting themselves or actually making the dog uncomfortable by attempting to pick them up. We have wheelchairs available for our dogs and cats to maintain good mobility. Those wheelchairs do need to be custom fit, so we should take an active role in helping our clients measure their animals for those devices. Don't be bashful about recommending ramps for dogs to get into and out of vehicles or onto and off of furniture. And be wise about recommending that our clients create non-skid surfaces for their dogs to walk on, and even for their cats sometimes to walk on. So another aspect of physical medicine in the area of pain management has to do with actual medical devices. And here we have such a great selection of tools we can use. And each of these tools acts on chronic pain from a different perspective, utilizing different mechanisms in the body. For instance, we can perform photobiomodulation using therapeutic laser technology. This is technology that is most often in my practice, actually used in my practice. We also have targeted pulsed electromagnetic field therapy. This is a technique and a technology that actually can be utilized at home. And in fact, in my practice, I most often use targeted pulsed electromagnetic field therapy as a tool my client can use at home in between visits to my practice for more formal physical therapy. We have medical acupuncture, and we can teach our clients medical acupressure to perform at home in certain cases. We also have medical massage. We now know that we can apply the same medical massage techniques that are used in people to animals with excellent, excellent effects. E-stim is another technique that can be utilized. This is most often utilized in conjunction in my practice with medical acupuncture. And then finally, a newer technology is extracorporeal shockwave therapy. The really cool thing about shockwave therapy is how it has evolved over time. Some of you may remember that when extracorporeal shockwave therapy was first introduced in veterinary medicine, we needed to fully sedate our patients in order to perform this technique on arthritic joints. If we didn't, it would be quite uncomfortable for our patients. Well, there's been modifications and updates to how the shock waves are actually delivered to the patient. So we now have a larger treatment area, and that larger treatment area means that the actual delivery is more comfortable for the patient. And that means that we may not, in fact, we do not have to rely on full sedation as we have in the past. This technology allows us to provide a treatment within about a 5-minute window. So it's very time effective in our practices. And this is a technique that is typically delivered through the course of 1, 2, or 3 treatments. And those treatments are separated by generally several weeks. So we may set a patient up for 3 treatments at, say, 2-week intervals to treat a particular joint. The really interesting thing about pain management at this point is that we've just come through a devastating 2-year period where many of our clients have been working at home and not in offices. And so what does that mean for us? Well, it means that they have an even more intimate relationship with their pets than they did in the past because they're with them all day, every day. So they're there to notice every little detail. They're there to notice when the dog doesn't move like it once did, that the cat doesn't jump up into the window like it once did. And so when we have an opportunity to treat a pet just 1 to 3 times at a 2 to 3 week interval, and we can make it very time effective for both the client and for us, we can even have one of our veterinary nurses deliver this treatment. This puts a really powerful tool into our hands. It is a technology now, extracorporeal shockwave therapy, that is safe for both cats and dogs. And as we all know as veterinarians, cats often get the short end of the treatment stick. So I'm really thrilled that this technology has evolved in a way that it is easily incorporated into any general practice that's paying attention to pain and pain management. Let's remember that we have an obligation in veterinary medicine to advocate on behalf of beings who cannot advocate for themselves. And pain is really fun to treat because it gives us a chance to restore our patients to a level of comfort and a lifestyle to which they had previously become accustomed. Thank you and have a great day.